The Stars and Stripes show is brought to you by the U.S. Embassy.
Well, it's Gabs FM, powered to engage your world. And of course, welcome to the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM. So now get ready for an incredible journey as we shine a spotlight on the remarkable progress being made in Botswana towards ending the AIDS epidemic by 2030. In a world where health and well-being are paramount, Botswana has actually emerged as a shining example of determination and, of course, resilience, with a strategic focus on achieving the UN AIDS 95 targets. This nation has actually positioned itself at the forefront of the global fight against HIV and AIDS. And of course, that means you, being the biggest stakeholder of Botswana Pty Ltd, have to be part and parcel of this great celebration. And of course, we're going to first start with the Meet America policy discussion. I'm speaking to Reba Gapi Kutaletso, who is the CDC Public Health Specialist, Monitoring and Evaluation. Welcome to the show, sir.
Thanks, Fred.
How was your week?
Perfect. Yes,
I need your life.
I love such answers.
I need your life. Perfect. Welcome to the show. Look, for those that don't know you and, of course, your portfolio and mandate under the U.S. Embassy, kindly introduce yourself and, of course, touch on your mandate with the U.S. Embassy in line with the Bias 5 report launch.
Yeah, thanks, Swift, and good afternoon to you and the listeners. Thank you so much for having us on the show.
Anytime.
Yeah. My name is Kutelezo Bahapi. I work for the Centers for Disease Control and Prevention, the Botswana office under the U.S. Embassy.
Well done.
Under the Strategic Information Branch. My role there is Program Monitoring and Evaluation Officer. And for Bias, I was one of those who were pivotal in the trainings because their bias involved data collection, interviewing people. So we started off with the training of trainers, the development of the questionnaires, the tools, and ensuring that the protocols are developed with and implemented with fidelity. So basically, I was one of those who were mandated with overseeing that portfolio.
Absolutely. The power of data and collaboration. And of course, just for those that do not understand, today we're speaking about the groundbreaking findings of the Bias 5 study. And of course, I think, let me backtrack with you. Just define the Bias 5 study and what it is and what it means, because the bias, are you a biased person? What does Bias 5 mean to the normal Motswana hela o tswang tonota?
Oh yeah, for Motswana, I would say Bias 5 is an acronym for Botswana AIDS Impact Survey.
Okay.
It means that it's the 5th Botswana AIDS Impact Survey.
Fantastic.
Which means there were 4 other surveys. So this was a household-based national survey. Among others, Botswana were aged 15 to 64 years. And of course, children who are aged 6 weeks to 14 years. The aim of the Bias was to measure the impact of the national HIV response because it offered HIV counseling and testing to participants in their homes. And the results were returned to the participants almost in real time, right away.
Wow.
And then we collected information about the uptake of HIV care and treatment services. So basically, that is the summary of what was transpiring in Bias 5.
Okay.
Wow.
Rabagapi, I think another question, like, why would it be important for us to be able to get these statistics and do this survey? Why is it important? Why is it important?
That's a great question, Samantha. As you might be aware, Botswana has been doing very well in trying to address the concern about HIV and AIDS as a pandemic. And for us to measure the successes that we are putting in our efforts and our strategies, we need to measure that through a scientific way. That's where the survey comes into place. Because the data is used to estimate the national incidence, that is the new cases within a short period of time or within a year, and also the district level prevalences and viral load suppression in our patients in Botswana. So that's why we need that data. It's very, very crucial for our programming and our prioritization of our health efforts.
Absolutely. And I think also, Samantha, that is so important in terms of informing policy and making the right decisions within the health space, because that goes to show that the BW government, in partnership with the American government, have come together to say, look, let's get accurate data. And I think it's important to shout out to Statistics Botswana, because if I'm not mistaken, they were also part and parcel of this collaborated effort, right?
Yes. Let's get straight into it, Rabarapi. You mentioned a little bit of how the survey was carried out, but let's look at how long it took for the survey to be carried out, and also specifically which areas you covered, and also examples of some of the questions tse leng gore ne di le mo surveying ya teng ha batho ba tla ba araba dipotso tse neng le di ba botsa.
All right. Thanks, Ami, for the question. In fact, what Swift mentioned is very important, because Bias 5, for record purpose, it was led by the Minister of Health, through NAPA, the National AIDS and Health Promotion Agency, and Statistics Botswana, as the government body that is mandated with all the data on national surveys in the country. So, with us from the USG, we came in through the funding and technical assistance. Yes, through our partners, University of Maryland, Baltimore, and Bumi. So, in terms of data collection, we started in March to August 2021. Across all the districts, there was a clear plan of how we were rolling it out across all the districts, ensuring that each and every corner of Botswana is covered by this important survey. So,
Okay.
Well, it's Gabs FM, power to engage your world. Welcome to the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy in partnership with Gabs FM, #America in Botswana. And of course, we're touching on the record achievement by the BW government in partnership with the American people. But at the end of the day, the BW government stands strong in line with ensuring that our nation is doing the right thing against the HIV and AIDS epidemic. Let me ask you this last question. Which areas in Botswana did the Bias 5 cover? And, you know, obviously examples used. Okay, no, my bad. Did you just ask that?
Yes.
Okay.
I think in terms of reception, the actual statistics from the survey that was done. Botswana batse rang the information, because at the end of the day, yesterday there was, you know, we got to see the numbers and figures that you guys found out throughout the survey that you said took place in 2021, March till August. How are people feeling about the numbers that have come out? Is it a positive response? Is it negative? And also, for a survey and work that, you know, in terms of the work and the funding that's needed for work like this, can we put a price tag in terms of how much money goes into getting statistics? Because you guys went through to every corner of Botswana. From the north to the south, to the east, to the west, there was no stone that was left unturned. Something like that definitely cannot be cheap. Around how much are we looking at?
Sure.
Guys, but can we just get an appreciation of the amount of money that was used for this very important survey?
To respond to that one, let me just take you back a little bit. When you mentioned about going from the north to the south corner of Botswana, remember, Bias 5 was conducted during the era of COVID-19.
Yes.
Second wave. So one of those is a very impediment to implementation of a survey of such a magnitude.
Yeah.
And therefore, obviously, to be costly. As you might be aware, the US government is working in partnership with the government of Botswana, and the cost attached to that might be a bit difficult to really quantify. But from the USG side, we approximately spent over $20 million towards the survey. And you know, like you are rightly saying, for you to get data, you really need to work very hard. There are many costs that are implicated with that. Implementing a survey within a COVID pandemic meant that you have to put people under strict measures, especially our field teams. We had to make sure that they are accommodated in properly.
That's
they had to
safe.
travel. So in all, it was a very costly exercise. So I really encourage that we all understand that it was a collaborative effort. The government of Botswana as well, they came in as well, we talk of vehicles, the laboratories that we were sending the specimens. People had to be working within those labs during COVID times, working overtime. Staff were engaged beyond normal working hours. So the cost, I think, is so huge. But from the USD perspective, we spent around $20 million. Thank you.
Wow, what a friends for. It's Gabs FM, power to engage your world. Is there any last words before we allow you to leave? And of course, thank you so much for representing the US government and partnership with the BW government.
My last word is to say, yes, we launched the report, and this is the start of the journey. Because from what you heard yesterday, when the acting president made his sentiments, he said that as the government, they're looking forward to attaining the last 5-2-2. Remember, it was 95, 98, 98. So which means that there's a gap, and that gap is the most difficult one. However, because I'm with my program colleagues here and our colleagues from the NAPA, they will shed the light on how we really embark together in this journey. And the ambassador has made a plea and a promise that we are there as strategic partners to really see this journey together. And I really thank Botswana for trusting us and working with us, and looking forward to working more with the government of Botswana. Thank you.
Well, I think only this song would be very fitting for the relationship between the US government and, of course, the BW government. This one is Dionne Warwick. That's what friends are for, isn't it?
Ke Botswana thought.
All the hits, all the time. Gabs FM.
It's Gabs FM, power to engage your world. Your time is 12:29 across the BW, and we continue with the Stars and Stripes radio show. And as we did say before, today's show is looking at the Botswana AIDS Impact Survey, the fifth one, where there was a report launched yesterday, if I'm not mistaken. And we're just appreciating the journey that Botswana has been taking in terms of the fight against HIV/AIDS. And in studio, we continue the conversation with guests. First and foremost, we've got Re Robert Selatu, who is the Manager, Research, Monitoring and Evaluation from NAPA, National AIDS and Health Promotion Agency. And he's not alone. Santsernale Medana Ramabia, who's the Chief Health Officer for Ministry of Health. Ladies and gentlemen, welcome to the show.
Thank you. We are so happy to be here.
Let's start. Ladies first.
Queens first. Queens first.
Just before we get into the appreciation of the work that you do. Me Diana Ramabia, you are the Chief Health Officer for Ministry of Health. What does your job entail? We run simple appreciate
yeah. Thank you, Samantha, and good afternoon, listeners, Gabs FM listeners. Like you have already mentioned, my name is Diana Ramaya from Ministry of Health, the Department of Health Services Management under the HIV/AIDS Division. My main role there is I'm one of the managers there, but under my portfolio, there are 4 programs. There's community home-based care, there's sexually transmitted infections, there's ARV program, there's PMTCT program. Of course, I do also assist in overseeing the prevention services like HIV testing services. There's also, what is the other one? BMMC.
Okay.
Or same male circumcision. Yes, and what the other program is behavior change intervention and communication, where this health promotion falls under. Thank you.
Wow. Okay, let's move over to you, Robert Selatu. You are the Manager, Research, Monitoring and Evaluation from NAPA, which is also known as National AIDS and Health Promotion Agency. Officer, what is it that you do? What do you do in your portfolio?
Thank you so much for having me. At NAPA, we are a coordinating entity. So, which means we provide a helicopter view of what is happening in terms of HIV and AIDS, and NCDs, which is why we will have the health promotion as part of Lina Larona Snapper there. It means we provide the strategic direction. We also resource mobilize so that the two conditions are well resourced. When it comes to HIV and AIDS, when it comes to non-communicable diseases. We also make sure that we provide the tools for monitoring these two, HIV and the non-communicable diseases. Now, under my division, we are responsible for providing the evidence, the numbers, and the numbers we provide through routine data collection in the Ministry of Health. But we ensure that they are well resourced to collect such information. Resourced human capacity, resourced hardware, resourced finance, resourced strategies. Under my portfolio, we also ensure that the numbers themselves are available to assist planning. And now we speak about evidence-based planning.
Yeah.
Therefore, we undertake studies such as Bonobo Baya Sejana to really assess to say, where are we in terms of HIV? Access to services, where are we? Infection rates, where are we? And so forth. You are going to very soon hear about a STEP survey, where we are going to do the bias survey equivalent, but for NCDs, spiritual steps, where we are going to try and say, as a country, where are we at diabetes? Where are we at the cancers? Where are we at this and that? So we provide the numbers, but we don't provide the service. Service equal health, which is why a lot of times you will not see me coming Kilenos because how important I don't provide the service. Let those that provide the services answer. But we are always together. We do these things together.
I think it's only fitting that we ask you as where are we as the Republic of Botswana. I know there is 95, 95, 95, and I also know that there is 95, 98, 98. Just clarify those two different phrases. Kana Botswana baba ngwa ba thaloganya go the 95, 95, 95, and what it means to the Republic of Botswana.
Yes. It's very important that we understand terminologies, especially when we speak HIV and AIDS. So key to learn is prevalence, HIV prevalence. What does it mean? HIV prevalence is the pool of people. It's a percentage of the number of, it is the percentage of people that are infected from the total population. 20%, our HIV prevalence is 20.8%. It means 20.8% of the population is living with HIV. This is what it means. And these are individuals that could have been infected in 1981, 70 something, whatever. Not 70 something, HIV wasn't there. But 2000, even yesterday. You see what I mean? So everybody living with HIV is counted as part of the prevalence, regardless of when they got infected. Now, there's what we call incidence. Incidence gives you an idea of the rate of infection. So, estimated annual infections. And we are saying our incidence rate is 0.2. So it means 0.2% of the population gets infected, newly infected every year. Newly infected every year. These numbers, 20.8% is our prevalence. This translates to around 329,000 people living with HIV. 20% of the absolute figures, you get an idea and magnitude. When we say 0.2 as an incidence, it translates to about 2,200 new infections annually. So that's a substantial number.
That is absolutely.
It's still high. We are making progress. Let me mention this. we are making progress ka gore re tswa from an incidence 1.35.
Yo.
When people are speaking 0.2. So it's a huge drop, but there's still more work to be done because 2,000 is a lot of people. When people were estimating the number of people who died of COVID, it was around that number if I remember. People who died from COVID. And everybody now feel like COVID and this is how many people get infected. So we still have homework to do.
Serious war, yeah.
We are getting there. We are one of the high burden countries in the world. But there's still something that we need to do. Now, coming to the 95-95 that you mentioned. 95-95, those are global targets, UNA's targets that member countries or member states ya ka Botswana ile member state yan re itamile gore re batla gore by the year 2025 ebe really gore mo bathong ba ba tshela le mogare 95% of them should know their HIV status. And then of those that know their HIV positive status, 95% of them should be on treatment. Of those that are on treatment, 95% of them should be virally suppressed. When you are at that level, we know you will have your mogare under control. You will have your epidemic under control. Jan, we are saying as a country today, after we've done this bias, we realize that we managed to attain the first 95. Indeed, 95% of our population knows their HIV status. And those that are living with HIV, more than 95% of them, which is 98%, are on treatment. 98. So we've surpassed the second 95. Of those that are on treatment, 97.8, I get 98%. It's 98% when you round off, are virally suppressed. And the possibilities for transmissions are further reduced. So I think this is, we are moving in the right direction. This is good development. It's saying we are getting there. There's light at the end of the tunnel. But even as we say this, there are areas that we may have to do more. Well, maybe before I go to those areas, another observation, which is an indicator that we are moving to the right direction, is that we seem to be having an aging epidemic. Prevalence, HIV prevalence, is moving more towards the older age brackets. Quarters, Banawa by 0 to 14 years, most of them don't have HIV. Oh, wow. Because of the success ya PMTCT.
Yeah.
Under 2% are born living with HIV from parents that are living with HIV. Under 2%. All of them, 98% this is a huge success.
Yeah.
Absolutely.
Back in the years, these were worse. So, but what we are seeing again, after age 14, 15, but majority of the people living with HIV today are in older age brackets. But new infections, whichever new infections that are happening, majority are happening among the youth, especially young girls and young women. There's a difference. The pool of people living with HIV is older age groups. But new infections are not taking place. Old infections. The new ones are taking place within the sexually active. Who are the sexually active? The sexually active are young adolescents and girls and women. And women most
Wow, that's very sad. It's Gabs FM, power to engage your world. Welcome to the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy. And of course, we're talking the Bias 5 report launch, appreciating Botswana's HIV and AIDS journey. And Samantha, we're fast running out of time, so we're going to have to push in order to meet our deadline of 1 p.m. Talk to me, Sam.
I think let's talk about the collaboration, because we do know that this was a joint effort, and we've been saying that Minister of Health the journey of getting all the statistics and the information in terms of collaboration in order to get the Bias 5 report. How were those partnerships important? Minister of Health, how was that important for you?
Thank you, Samantha. Remember that HIV response is a multi-sectoral response. Minister of Health alone will never have managed to conduct such a magnitude of survey. We realized that Bakapi mentioned funding.
Yes.
Funding is the highest amount of funds came from the American government. It's because of that collaboration, partnership. Secondly, we realized that for you to conduct that such a survey, you need experts. Minister of Health alone, we don't have all the experts that we needed to conduct such a survey. So we found that we were working with ministries like Stats Botswana, when it comes to statistics. We were working with partners, implementing partners like University of Maryland, Baltimore. We were working with CDC. And from all these partners, you tap all the expertise, and those expertise, at the end of the day, they produce good results. Otherwise, from there again, remember that you need capacity. Minister of Health has capacity in terms of bodies, not necessarily the skill. We need partners. But I got the technical expertise, even the numbers. That funding, we hire more people to be able to conduct the survey.
I think another thing is just an appreciation, Ghana, for us to appreciate how far we've come. Re Salato spoke on things such as the rate of infection, being at 0.2% all the way from 1.3%. Let's look at the past 20 years of, the fight against HIV/AIDS and where we are now, just so that we can have an appreciation of the fight that, we as a nation are really putting through just to make sure we meet those numbers by a certain year.
Exactly. Thank you. HIV, the first HIV diagnosed person was in 1985. By then we didn't have anything. No drugs, nothing. But
Lady Clinic.
Pardon?
Lady Clinic, I'm sure we didn't have as many clinics nationwide.
Yes. But remember that now, in 1999, the government introduced a mother-to-child transmission program in 1999. And in 2002, ARV program was born. Yes. But by then, we only had 4 facilities that were implementing HIV services, 4 hospitals. And the government did not have enough funds to probably roll out the services. By then, we had around 5,000 patients. By the way, they were HIV positive by then. And with time, we realized that the services, there was a rollout of ARV services to the clinics, be it testing, be it PMTCT, PRV program. Right now, we are talking around 655 facilities that are offering ARV services from 4 hari simolola to more than 600 facilities offering ARV services. Secondly, we found that before the introduction of PMTCT, mother to child transmission, it was 40% without intervention. Mr. Salaton, it's less than 2%.
Yeah.
You can see that yeah, it's because of the commitment, the government, political commitment, the government. There were so many interventions that were introduced to make sure that the services are taken to the people. When you look at treatment, Botswana is one of the countries selling WHO reintroduces a none, where the first will be the first country to adopt that.
Yeah, to implement.
Exactly, and adopt and implement. We are revising our treatment guidelines. When we started, we were using drugs that were very because there was no choice by then. Probably the side effects. But now we are talking of drugs that are user friendly, and we only take one drug once a day. And we used to take how many drugs? Probably 3 times a day or twice in a day, more than once, one tablet. But one tablet once a day. Then what are the side effects? I think and even there's viral suppressions. Once we initiate one treatment, I can tell you in 3 months' time you are virally suppressed. So hela do it so di suka gone gore nere gatela go pele.
It's Gabs FM Power to engage you. Well, let me afford you this opportunity to share your parting statement. And of course, what would you like the nation of Botswana to know and understand in line with this HIV epidemic? The war's not over. We have achieved a great milestone, but now we're trying to say, look, let's keep alert and let's keep on going. Perhaps you can share your parting statement, especially, I think, Samantha, to the youth of this country. Parents must understand at the end of the day, HIV and AIDS is affecting Banabarona, the youth, the ones who are sexually active, especially leaning on one side, which is the girl child.
Girl child.
Yeah, thank you very much. Yes, we have achieved what we have achieved right now, and we know that globally we are receiving accolades, but we still have a lot to do when it comes to our prevention services. We can see that our adolescent girls and young women, we have new infections in that group. This is where we need to channel our strategies, our innovations, so that we can be able to close the gap, the remaining gap of 522. If we need to make sure that by 2030 we would have achieved epidemic control, we have to make sure that all these gaps, we close the gaps.
Motsadi Waka, allow me to take this call. Kindly put on your headphones in front of you in order to hear. Gabs FM, good afternoon. Hello. Hello? Hello, sir. Erra. Your Gabs FM live. Ribuaka HIV and AIDS and Bias 5 survey live in the studio. Would you like to comment on that?
What's the topic again?
The HIV AIDS epidemic and appreciating our journey as the Republic of Botswana in line with the Bias 5 report. What is your take?
I cannot give you my take now, unfortunately, because I'm live as well from work. That is prohibited. Rather call from my cell phone at lunch. I'm getting to lunch now at 1 p.m.
Oh, unfortunately. Sorry, brother. Lena, I cannot unfortunately transfer you to Remo Koto because you called live in the studio. But anyway, make sure you know your HIV status, okay?
I do, sir.
Thank you, sir. Have a fantastic afternoon. Sorry about that. Moving swiftly along, pun intended. Motsadi Waka, you are still closing and sharing your parting statement.
Yeah, thank you. No, I was just going to say that we need as partners, we need as government to continue working on making sure that where the gaps are, we need to close those gaps.
Yes.
Absolutely.
At the end of the day, remember that yesterday our VP mentioned that HE said that our target is 100, 100, 100. So we need to make sure that we achieve the 100, 100, 100. Thank you.
It's Gabs FM Power to Engage Your World. Sir, let me offer you this opportunity to share your parting statement.
All right. My parting statement would be, we are not yet there. We are not at the finishing line yet. Infections are going down. This is going down. HIV thing. Before the activity. The take-home message is this: HIV is still there. People are still getting infected. Although we are making progress, but we are not yet there. And progress, we can achieve it and get to the finishing line if we as individuals make sure that we do something. Because it's through our collective efforts that we will win and get to the finishing line.
Reselato, let me hope that this next call, okay, is not necessarily need a transfer, but a comment or appreciation by the Botswana listening. Gabs FM, good afternoon.
Yes, sir. How are you?
Fantastic. How are you, Mrapa?
One of his parting statement, there is only quickly what I should call, right?
Error.
Because I think Basanto is a challenge one, because renal intervention is saying that people have dropped the ball. Interventions like Bonebo Prep. I think the Lord Batoyan they let their guard down. Because especially the youth, treatment doesn't like virally. Suppress the high infect one and then reckless.
No, thank you.
So I think a lot of education robust. Thank you.
No, thank you, sir. Thank you. You do know your HIV status, right?
Yes, yes.
Very important.
Since donkey years ago. Cool.
Thank you, sir. Sir, sorry. And in closing, is there anything else you'd like to add before we close the show? At the end of the day, let's ensure that we understand and know our HIV status. And of course, let's do more sex education from the homestead, you know, whether we like it or not. But Zadi need to get involved in an intergenerational conversation between us and the younger generation in order to understand the direction, whether we like it or not. It's part and parcel of our society. Anything you'd like to say, Samantha?
I was at the event yesterday and there was a young lady obidwa mamzina abua a poem. So reslata how bua now o kharletsa I'm reminded abua ka Lina Levisi Romo abua gore okay, we are not where we were, but we are not where we want to be, but at least the progressing. So let's be hopeful and keep fighting.
Well, it's the Stars and Stripes radio show, proudly brought to you by the U.S. Embassy. Somebody says congratulations to the team in the studio and a special thanks to the United States government and all associated organizations for their help. This is a milestone achievement. And on that note, good afternoon.
The Stars and Stripes show was brought to you by the U.S. Embassy.